Hello, I'm Canaan Prater, a hip and knee orthopedic surgeon at OrthoCarolina. Our foot and ankle surgeons have been using weight-bearing CT imaging technology for years as part of their clinical workflow. Recently, I have started ordering scans on some of my patients as well. Today, let's take a closer look at the system and how it works. Hey there, I'm Dr. Prater.
Hi,
I wanted to come over and see where my patients are getting these CurveBeam scans.
Okay, yeah, my name is Savannah. I work here at OrthoCarolina Foot and Ankle. I do a little bit of x-ray and I get the opportunity to work with this equipment. This is basically all we have right here. Very small, very convenient, very efficient. We get a lot of patient reviews. They love it.
It is definitely a lot smaller than I thought that it would be.
Very small, very quick, less anxiety, less stress for the patients.
Yes, you mentioned quick. How long does it take to do a scan?
So a regular foot and ankle takes about a minute. If we was to do multiple joints like the knee and the ankle, it would take like 2-3 minutes.
Still really quick.
Really quick, yes.
I noticed too, looks like it's pretty easy to get in and out. Can you kind of explain what the patient experience is like? What people say about it?
Patients really enjoy just being able to step into a machine instead of having to lay down and go through the process of their body sliding in and out. A lot of patients are claustrophobic. This kind of suits and kind of comforts them.
I get that complaint a lot about, hey, I can't go into whatever it may be because I get scared about it. So yeah, I can imagine this being a much easier, less stressful experience for them.
Yes.
How many of these do you do in the course of a day?
The most we usually do is 15.
Can you kind of just tell me kind of how the process works?
I do have a patient here.
Oh,
if
really?
you want to hang out and see how we get this done.
Would love to.
Okay, perfect.
Hey, so I'm Dr. Prater.
Megan, nice to meet you guys.
Thanks for letting me watch your scan today.
So I take off both my shoes?
Yes. You'll slide off both shoes, both socks, and then I'm going to have you roll your pants up above your knees as high as you can get them for me.
Got it.
Perfect. Have you ever had one of these scans before?
I have not.
Okay, perfect. So what we're going to do first, we're actually going to get a quick measurement. That way this CT machine knows how high up to go, okay? So I'm going to have you come right over here for me. And then what I'm going to have you do, face towards me. Perfect.
So what are you measuring here?
So we basically get from the top of the hip down to the bottom of the knee. It just makes the machine go to where it needs to go to get all the anatomy included.
Make sure you get what we're trying to see.
Yep, diagnosis, yep. And then what I'm going to have you do from there, I'm going to let you come and stand right up in this circle. All right.
You face in or out?
So you're going to face towards that wall for me.
And what does this do?
So the black piece that I had put in there is for patient stabilizing. Okay. They can lean against it just to keep them a little bit more still, since CTs require you to stay really still. We try to aim for no motion. So what I'm going to have you do, step forward just a little bit more for me. Yep, perfect. And then this is just the same thing as the stabilizer. We just kind of wrap it around here just to keep them a little bit more still.
Now, if you wanted to get a view with like their knee flex, is that possible to do with this as well?
So what we'll have you do, I'm just going to have you bend your knees, squat just a little bit. Yep, perfect. So that's how we would do the degree of flexion.
Okay. Seems pretty easy.
Yes. And then we just shut this door.
So normally I order these for more planning for my knee replacements, but I guess theoretically you could use this for any type of replace any CT scan, like for fractures or anything else.
Yes. We can do bilateral or unilateral.
Okay.
So this is where we will come to now. It's going to have me go out here.
It definitely is quicker than I thought that it would be. It seems way less invasive. Just the fact that it's easy, they just step up on it and step right off. I just, in my mind, I envisioned it being bulkier and a little more intrusive, but it actually seems to be quite seamless and an easy process. So how did that feel?
It was good. I felt like I wasn't suffocating in an MRI machine, but it was stable, and Savannah did a great job explaining everything. So.
Could you feel anything while it was going on?
A little bit of like vibrations, but so far it felt really simple and plain. It didn't feel like there was anything painful about it. So
awesome.
It was really nice.
Did you feel nice and sturdy standing up there?
Thank goodness for the wet.
Yeah. It seemed to be pretty easy.
Yeah.
It was very quick.
I was surprised how fast it went. So
yeah.
That was really nice.
Well, Megan, thanks so much for your scan. And Savannah, thanks for showing me this machine. It was a really cool experience for me to see how this works. I know my foot and ankle colleagues have been using this for a while. I've been using it now for a year or so, but it's really good to kind of see it in action and kind of get an experience of what the patients go through whenever we order these tests.